Okay. Okay, I'm Ginny. I'm 56 and I was diagnosed last year, the summer of 2017, with tonsil cancer. That was the primary source anyway to begin with. So it was diagnosed, it was stage one. When I first went to the doctor initially, to my own GP, it was because of a lump on the outside of my neck. They sent me for blood tests, which were clear. So I thought that was great. So off I went on holiday to New Zealand, where my son lives. No worries at all, but came back and it was the lump had got bigger. And when I went again and they had a look inside my throat, they realised they took a biopsy of my tonsil and realised that it was that came back as the primary source actually of the cancer was the tonsil, and the secondary was the lump on my neck. The lump was the secondary cancer, and then when they sent me for an MRI scan, they found a third one, which was so the lump here and the third one, which was actually inaccessible, which to this day I'm not sure where it was, to be honest, but it was somewhere they couldn't do surgery on. They were the secondary sources. So because of that, I then didn't have surgery. I just had radiotherapy and chemotherapy. Yeah, the reason they didn't do the surgery at all was because they couldn't obviously access the third one. So with that, they just gave me, I had a weekly dose of chemotherapy for 7 weeks, once a week, and I had, during those 7 weeks, I had radiotherapy every day for the 7 weeks. Sorry, except for the weekends, 5 days a week for the 7 weeks. Well, it was difficult to know what to expect, even though you were told what to expect until you'd experienced it firsthand. You know, it was difficult to understand. I was lucky enough to have a chap on the Isle of Man where I live who'd been through it himself 4 years beforehand and very unusually had exactly the same three areas with his. So he'd explained a lot to me. I was treated at Clatterbridge and they were excellent actually. And before the procedure in getting you over, and I had a fitting for a mask that I was going to wear, and they talked you through all of that. But the couple of things that threw me, if you like, at the beginning were how tight the mask was, even though they'd said it would be. It was very, very claustrophobic, and I did struggle with that. But in time, even to be honest, by the second day, it was a case of mind over matter. You had to have it done. And although I am claustrophobic, you know, they were very good, the staff, and it just talked you through it. And it may, you know, if you relaxed, it helped. And you did get used to that, although at first it was very scary at first. Because of having the chemotherapy and the radiotherapy, unfortunately, they both give side effects. So the two side effects together, you know, were difficult. But again, the hospital were great at helping you to manage that. The chemotherapy, initially for the first 2 weeks, no side effects. I thought, here we go, this is easy. And then the third week, it started to kick in, and I was very sickly with it. Not everybody is, but I was particularly sickly with it. And again, they were great at helping with the anti-sickness drugs until it honestly took until about week 5 to find one that did stabilise me. But that the side effects of the chemotherapy with the sickness and the side effects of the radiotherapy were the dry mouth and the lack of taste, which again, for the first 2 weeks wasn't, you know, didn't seem severe. And then as the weeks went on, got tougher and tougher, which was swallowing, dry mouth, sore mouth, roof of the mouth. But I think the chemotherapy as well caused some of the roof of your mouth, etc. as well. So it was double side effects to cope with, which did get worse as the weeks went on. But to begin with, weren't too bad. The radiotherapy itself wasn't painful during it when you had it done, and it was literally it took about 7 minutes a day, and the radiotherapy itself. First of all, they do the CT scan to check it's all in the right place. And then the radiotherapy itself was a minute one way and a minute the other way. And it wasn't painful. The procedure itself wasn't painful. But the effects for your throat and your mouth was painful. But again, they gave you a lot of help with medication and a lot of advice, you know, for things that would ease that during the whole treatment. It is manageable. One of the hot, difficult things that I found, although my husband was very good at this side of it, was managing the medication because there was so much, and it did get quite complex because obviously there was some for the chemo, some for the radiotherapy, all different times a day, and I would have struggled without his help for that. But I have spoken to other people that the staff at the hospital helped them with that because it's a lot to take on really when you're already, you know, not feeling good. But it was manageable with that. I think different medications work for different people, but they're good at helping you out with that. It was completely by surprise before I was diagnosed because the lump I had on my neck that I went to the doctors with, I had no pain with it whatsoever. I had no symptoms inside my throat, tonsil. Not ill. I was really healthy. Was going to work, was going to the gym, etc. And literally, just because of the things you do here these days about lumps being checked out was the only reason I went. And even when I went back the second time, it hadn't. Although the lump had got bigger, it still wasn't painful. So I had nothing at all to indicate that I wasn't well before that. Really good, really good. I'm 10 months since the diagnosis and 8 months since the end of treatment, and I literally went back to work 2 weeks ago. And so from the end of treatment, they'd said all along you'd be a good 6 months before you were really fully fit again. Which, to be honest, I thought, oh, I don't think I'll be that long. I'll be better than that. But oh, it's a very slow process, the recovery. And although you're recovering all the time, it's step by step. And it's not until after the 6 months that you fully feel fit again and ready to do everything again. But I would say after the 6 months, I had gone full circle to returning to everything I used to do. No, some of the dry mouth and some of the symptoms, even after the 6 month treatment, have remained, but they're very manageable now. I think from speaking to other people, everyone's a little bit different. But for me, swallowing, I have to think when I'm eating a meal, I have to eat slower, smaller portions. And it is experimental, even to this day. Some things can get stuck that I'm not expecting to. But when I say get stuck, I'm not choking, I'm just having to think about swallowing. And one of the big things for me, it's such a slow recovery that there is a point 2 or 3 months after treatment that it's very difficult because you start to think you won't eat again properly, you won't drink again properly, you won't socialise again properly. And I was worried about not eating in restaurants or going out. But now, if I go out for a meal, I can always find something on the menu that I can manage. And it may not be what I'd have chosen before, but I can always manage something. And again, socialising, drinking, and being out with friends is something I thought we wouldn't return to because it took a long time. But after the 6 months, fully back to my social life and managing all of that. It didn't affect my speech as such. I mean, I had with a sore throat anyway, your speech is affected a little bit. There was days when I just didn't want to talk because I was so shattered, but it didn't actually affect my speech as such. Yeah, I think the support of family and friends is massive. Obviously I had a great medical team too, which, the confidence there was great, but the support of family and friends all through it, is a great boost. Well, when I was first diagnosed, it is such a shock, and it's, you don't understand any of the procedures or treatments. I was very lucky on the island. We have a very good network in the ear, nose, and throat department. So the medical staff there are involved with ex-patients who will talk you through experiences. So for me, I chose not to look any of it up just for my own personal reasons. I didn't want to sort of go down that route. But anything that was explained to me at the hospital, I could then that I didn't understand because there is a lot to take in. Although they were good at trying to explain it, I could talk to the patient I knew who'd had it 4 years previously, and he would explain everything to me because particularly the mask fitting and things like that, it was hard to understand until you'd been through it. Oh, right. I've actually got it. Do you want me to? Right. Let me get it. I'll
Sure.
just try not to knock everything off. This is the mask, which looks pretty horrific. So actually, your whole face goes into that. So the mask itself is molded to you individually, and then you're actually pinned. So you're lying flat on the bed, and then that is pinned. These bolts that are here at the sides are pinned down. So it's very, very tight. Where the mesh is on the front of that screen, sorry, on the front of the mask, actually indents your face. So when you first come out, that's how close it is. Yeah, but it's so that they can get the radiation in exactly the right spot every day. So you do get used to that, but obviously when you're first told about that, it's quite a
So,
shock. So it was mind over matter with the claustrophobic bit, yeah. You could keep it or you could leave it there. And at the time, I thought I'll bring it home, and it's just sat, and I've never looked at it. But I think one of the things I found very difficult, I didn't expect to, because they tell you it's 7 weeks treatment, and it'll get tougher and tougher over the weeks, which it does. And because you don't have any side effects for the first 2 weeks, that's the knock-on effect of your last 2 weeks after treatment. So the side effects kick in 2 weeks after you start. So of course they remain 2 weeks when you've finished. So your worst bit, recovery is those last 2 weeks when you've finished your treatment. And at the time, you're so delighted that you finished the treatment, and psychologically, that's a great thing. That it's a shock that how downhill you go during those 2 weeks. And I was told that beforehand, and they did prepare me for it, but it's something that psychologically is quite hard to deal with. I thought I've finished the treatment, but I feel even worse, But so I ended up in the local hospital here when I came home for 3 weeks because my bloods were right down and my temperature was right up. But it's not unusual; it does happen, and they can get you through that bit, even though it was the worst bit, really. Although there was a relief of the treatment being over. Chemo I was given, and they told me right from the very beginning, for whatever reason, it doesn't. It's called I can't say it now, cisplatin, and it just, for whatever reason, you don't lose your hair with it, which actually was a great help. It was one less thing to deal with, if you like. Yeah, the staff were amazing, really amazing at Clatterbridge. They were fantastic all through it. And the other thing that I had actually, which I was told right from the beginning, because during the 7-week treatment, so towards difficult to remember actually, maybe 4 or 5 weeks in, you're finding it more and more difficult to swallow. So you're going on to soft foods, you're going on to custard and porridge and such like. But eventually, it really is too sore to swallow. You really, really can't. So I had what they call a peg feed, which is a tube into your tummy, so that all the calorie drinks and nutritional drinks, etc., can be fed into this peg in the tube, which was something that I was helped with a lot with the ex-patient who explained it to me, because when they told me about it, I had no idea. But it was such a benefit to have that. It was such a relief to stop having to have this really trying so hard to get anything down. And of course that topped you up, so calorie wise you were kept fine. And there was even an overnight feed, which again sounded very bizarre, but it was a great big huge litre bottle, but it just fed on a pump overnight, and I literally slept through it every time. You switched it on, and it fed like half a teaspoon every half hour, or you could set it to whatever rate you wanted. The alarm would beep when it was finished, and you detach it and just flush the water through. So all of that, although it sounds very, very traumatic, when it was explained to me beforehand, I was more worried about it than when it happened. It actually is very manageable. And the tube itself, I didn't notice I had it, after a while. It was part of you. And I actually had that right up until February this year, because to keep your calories up, even once you can eat again, to keep your calories up, you needed to have the overnight feed. So even though I was desperate to get rid of it, it made sense to keep it to keep your calories up. And then the removal of it was very easy as well. It was just literally no problem, no anaesthetic, nothing, just removed it, and then it heals over. So that's, yeah. Because I mean, it's, if someone had said to me you're going to have a feeding tube for 8 months, I'd have been quite horrified. But when it happened, it wasn't actually a problem. It was just part of it, really. Definitely, yeah. Especially when when I ended up in the local hospital here, I actually couldn't swallow at all, even water. So you needed that, the safety net of the feeding tube. Yeah, the biggest piece of advice somebody gave me, and I would definitely have given it to anyone else, is to literally take every day at a time. Because all through the if you keep thinking ahead what's coming or worrying about what's coming next, but even the times that were difficult, you would have a good day and then a bad day. And maybe after a really bad day, the next day it would be a good day. So it is literally to take every step as it comes. And even after the treatment, which was a good, like I say, a good 6 months recovery, because you're recovering slightly all the time, you start to think you're better, and you've still got a long way to go. You have to be very patient, I would say, with the aftercare. You have to be patient. I mean, I myself, and I'm sure other people have thought the same. You think, I'm never going to return to eating normally. I'm never going to return to going out for a drink with friends. I'm never going to return to the gym. But you will, but it will have to be patient. But the one day at a time throughout the whole treatment really was, is the only way really to look at it, to cope with it. Back at the gym and back walking the dog and back out with my friends and back socialising and on holiday, been on holiday, etc., which is something I thought I might not. So I have gone full circle and returned, which I'm sure most people will. It's just that, the initial shock that is difficult. The only other piece of advice, and I'm sure it happens to everybody, is when you're initially diagnosed, it's such a shock yourself. You have to have time to take it in. And the worst bit of it all is obviously to tell your family, our children are grown up, but to tell them. And it's an awful shock to them, and everyone has to get their heads around it. But once, and it does take a little time, 2 or 3 weeks, once you have got your head around it and you've begun the treatment, I would say for myself and my family, you could just get on with it. The initial shock is too difficult to compute, if you like. But once you have got that initial shock and the family is supporting you and they're seeing that you're coping okay, etc., it does, that bit of it got a lot easier. That was the most difficult bit at the very beginning.